for a healthier planet. You're welcome to ATP Live. And this is our symposium for the Breastfeeding Week year 2020. I have two beautiful doctors, two very seasoned professionals in the studio this evening, and we'll be exhausting everything you need to know about breastfeeding. So I want you to invite your friends, get your family members, join in, watch on Facebook or on YouTube, and invite as many people as possible so that we can all learn. And don't forget, you can ask your questions in the comment box. Our professionals are here to take all of your questions and to cancel all those myths that we hear about breastfeeding. Don't do this, don't do that. Don't worry, we hear from the professionals. So, welcome to ATP Live and welcome to the Breastfeeding Week 2020. This is our live symposium on breastfeeding. Welcome. So, I'm going to bring our professionals on board. The first person I have here is Dr. Zainab Opola. Dr. Zainab Opola. She's a general pediatrician with particular interest in pediatric neurology. So, welcome, Dr. Zainab. Thank you for joining us.
Thank you, ATP. Thank you, Okwe, for having me. I'm glad to be part of this symposium, educating mothers and brothers, sisters, fathers, everybody on breastfeeding. As breastfeeding is very important as we go along this presentation, and it's like the bedrock of the future of our children. So we should have even just the minimal understanding and how beneficial it is to us, the mothers, the children, and even as a nation as a whole. So I'm glad to be here, and I hope everybody benefits from this. And sit tight, listen, jot down your questions. Be glad to have them. Thank you.
Thank you, Dr. Zainab. Okay, I also have Dr. Oluwatosin Amor. She's a senior registrar at the Lagos University Teaching Hospital, and she's also a member of the Academy of Allergy and Clinical Immunology. Join me to welcome Dr. Oluwatosin Amor.
Good evening, everyone. It's a pleasure to be here speaking at this live symposium on breastfeeding, very, very crucial subject, just as my friend and colleague has said. We cannot overemphasize the importance of breastfeeding, and any opportunity we get to speak about it, to teach and create awareness about breastfeeding and all the benefits, all the good things that come with breastfeeding, we will take that. We will be very glad to be part of it. Once again.
All right, thank you for joining us. Like I said earlier, invite your friends. You can watch on Facebook. There's a watch party right now. You can join us. You can watch on YouTube. Invite people. Send the link out so that you can ask your questions. Yes, you have opportunities to ask questions from professionals live on the show. Yeah, it's Breastfeeding Week 2020. Welcome once more. All right, Dr. Zainab, you have something packed for us. Are you ready to?
Well, yes.
Dish it out?
Yes.
Okay. All right. Very good. So I'll be sharing your slides and we'll okay, just let me know when you can. Okay, while we're waiting for that to come, don't forget to post your questions in the comment box. Don't forget to post your questions in the comment box as I'm here to take all of your questions. All right. Okay, so Dr. Zainab, can you see the slides now?
I can see them.
Okay, so over to you, Ma.
Okay, so this is just a brief run of what breastfeeding is all about. I try to pick out the important things that will benefit us as mothers, fathers, as concerning breastfeeding. So as the moderator said earlier, the theme for this year's, for this Breastfeeding Week 2020 is support breastfeeding for a healthier planet. So my presentation will kind of go along that line, and I'll try to link it to how we can support breastfeeding as we know about it and as we go along. So next slide.
Okay.
So, well, people define breastfeeding as it's defined as feeding a neonate with milk directly from the human breast, from the female human breast, and not the bottle or the container. So, breastfeeding is when your baby actually feeds, and this is a picture showing a mother breastfeeding her baby. Next slide.
Okay.
Okay, so how long do you breastfeed for?
Okay. On.
So for newborns, well, before I go to how long we breastfeed, let me just define some terms that we use. Somebody will say, "What is exclusive breastfeeding?" Exclusive breastfeeding is giving the baby just breast milk only, no water, for 6 months. That is what exclusive breastfeeding is, giving the baby milk without water. I'm stressing without water because we ask mothers, "Oh, are you exclusively breastfeeding?" They say yes, but when you ask again, "Do you give water?" They say yes. So that doesn't make it exclusive. And it's for 6 months on demand and that. So you can still give babies drugs in between. That doesn't disrupt whether it's the definition of exclusive breastfeeding. And it now becomes continuous when you give for up to 2 years. So after 6 months, you add other feeds, complementary feeds, and you continue breastfeeding for 2 years. I'm sure some mothers will be like, wow, 2 years? Are we going to breastfeed for 2 years? But that's the WHO recommendation to breastfeed for 2 years. So how long do babies nurse? For as newborns, you could just nurse for 5 to 10 minutes. They are newborns, their tummy is small, so they don't have the capacity to take enough milk. So they nurse for 5 to 10 minutes, and they breastfeed as frequently as every 2 to 3 hours. As they grow older, the time they spend on the breast milk stays longer, and the spacing can be longer. So
Longer.
by 6 months, they just breastfeed for maybe 5 times, 3 to 5 times daily, compared to about 8 to 12 times when they were smaller newborns or when they were smaller infants. Next slide. So what kinds of
Okay.
milk do we have? There's the colostrum, and I'm showing a picture. The yellow one is the colostrum. They call it liquid gold. So, well, breast milk generally is called liquid gold because it's a very precious milk and you want to keep it and treasure it. And some mothers find it difficult to express it. So, it's liquid gold in any form. So, colostrum is the very yellow one, and that's usually talked about, described as the first immunization of the child. It has very high protein content and protects the child against immunization. So, when the baby is born, it's usually advocated to give colostrum as soon as possible. The breast milk is usually that colostrum is by the second trimester, towards the late trimester in the mother. The breast glands are already developing the colostrum. So even when the baby is born, the colostrum is there for the baby to get. So it comes in very small quantity. It doesn't matter. It could even be as small as 5 mils or 2 mils, but it is very rich in protein and is usually encouraged for babies to have that as early as possible. Then you have the transition milk, which usually stays for like 10 days, usually present like 10 days to 14 days. And then you now have the mature milk, the milk that is there till the mother stops breastfeeding.
Okay.
Next slide.
Okay.
So now, after we've known what kind of milk we have, so what are the signs of good attachment? So when you know you're having an effective breastfeeding is when your baby has a good attachment and good position. So how will you know that my baby is properly attached?
Okay.
Number one, the breastfeeding process should be pain free. It shouldn't be painful in any way. Once you are feeling any sort of pain, that attachment isn't good enough. Then the nose should be close to the baby. And the sucking pattern, you should actually hear the child making the swallow movements. One of my teachers will say, you hear pokoi, pokoi, pokoi. When you hear that, you know that yes, my baby is swallowing milk. And
Okay.
baby finishes feed and comes off breast on the. So the baby stops, actually withdraws by him or herself. So you don't have to say, is it not enough? Once the baby is full and has been attached well, the baby just leaves the breast. So there's full rounded cheeks. The chin is firmly touching the breast. You can see this picture. The chin of the baby is actually touching the breast of that mom. And the baby has a large mouthful of breast. So the whole breast tissue is inside the mouth of the baby, not just the nipple. Sometimes it's just the nipple that will be in the mouth. That is not a sign of good attachment. Next slide.
Okay.
So how do you know your baby is well positioned? So positioning, aside from the baby attaching to the breast milk, the position, the way you carry the baby, the way the baby is positioned, that is also helpful to have an effective breastfeeding. So there's this mnemonic, they say chins. Make sure the baby is held close. So how close is the baby? Normally they say the baby's tummy should be touching the upper part of your tummy. So if the baby is held in that way, that the baby's tummy is touching the upper part of your tummy, then the head tilts. The head too should be actually in your elbow. The head should be raised up in your elbow position, and the hand is at the back of the baby's head. Then the baby is in alignment in a straight line. So the knees are not bent somehow and the head somehow. So the baby should be in a straight line on your hand. Then the nose of the baby should actually, the nose to the nipple. So I said that in attachment, so they overlap. So the nose of the baby should be facing the nipple, should be opposite the nipple, and it should be a sustainable position. So you should be comfortable when you are positioned. You shouldn't crouch your back or lie. So you should be comfortable. I'm still going to show other positions of breastfeeding. So whatever position you are, you should be comfortable. You shouldn't have back pain, and the baby should be well rested on your arm and the body facing your body. Next slide.
All right. Well done, Doc. Okay.
So these are just some positions. I don't know if it's clear because of the kind of diagram I used, but these are the positions we have. So the most common one we use is actually the cradle position. I'm sure everybody is familiar with the cradle position, where the head, your elbow, but you can always do a cross cradle position. That's the opposite, the other way. So the hand this time around is touching the back of the head of the baby. And you can do the back line position when you're lying down and the baby is just on top of you and the breast is trying to suckle the breast. Then you do the football position. That is another position, not so common because some people are not really comfortable with it. Then the sideline position is very common, but at the same time you have to be careful, especially maybe when you're nursing at night. So you have to be awake. You have to make sure your breast is not over the baby's nose, and so that you can prevent aspiration and SID, sudden infant death syndrome. But that is another position. Sideline too is another position. Inverted line and all that. Next slide, please. So we go to the benefits. The benefits of breastfeeding can never be overemphasized. Like, there are so many benefits. I just picked out a few. It helps in the cognitive development of the child. So your brain, studies have shown, the slide is off.
Sorry, just go on.
Okay, so studies have shown that babies on exclusive breastfeeding are their cognitive development is actually higher than those not exclusively breastfed. It also prevents the predisposition to allergies in future. It prevents the development of chronic medical conditions like obesity, type 1 diabetes. It promotes a good weight gain for the baby. You don't want a malnourished child and you don't want an obese child. So breast milk does that. Breastfeeding does that. It helps to attain that balance. And it's easier on the digestive system. With breastfeeding, you have less constipation, you have less colics, you have stool, having stools is easier for the child, and the baby tolerates it easily. It prevents less intolerance. Then it helps in the development of the immune system. A baby that is just born the immune system is not as developed, so we depend on a lot of antibodies from the mother, and breast milk is a very good source of that and helps to get maximize all the antibodies we get from the mother, reduces the risk of infection due to all these antibodies and these special enzymes in breast milk. Babies have a very low risk of infection. Next slide.
Infection. Thank you.
So I think I've said this, there's less predisposition to dental problems, less ear infections, and next slide. So for the mother, so there's this early maternal infant bonding. It's I don't know, it's a that's one very big plus for breastfeeding. So your baby and the mother is bonded, and it helps in the contraction of the uterus. When you breastfeed, the hormones release help to contract the uterus, so making the uterus go back to its normal position, reducing bleeding and all that, because when the uterus contracts properly, that's done. It provides emotional well-being of the mother. It makes the mother confident, it makes her proud, it makes her happy. And long term, it also reduces breast and ovarian endometrial cancer, lessens osteoporosis, and benefits of child spacing. It's not absolute for everyone, but breastfeeding has a way of, yes, it's not absolute. It can fail. Even contraceptives can fail. So
Sure.
breastfeeding just has that added advantage. But still, if you really want child spacing, it's still advised to do some form of family planning. But on overall, breastfeeding helps in child spacing because that period they are not menstruating, your hormones are still in the lactation phase, and those hormones kind of inhibit the hormones that are responsible for pregnancy. So, but that's like one of the advantage. Next slide. Then the socioeconomic advantage, it saves money. So there's no how. Doing exclusive breastfeeding your child saves a lot of money. Money you could use to do other things for the baby. You could even start using it to save for the financial future of the baby. You could use it to do other things. And with that, with the other benefits for the baby, there is reduced hospital visits and the medical bills you'll be paying with that. And with all that, it gives the mother more productive time to do more useful things and make more money. So overall, breastfeeding has a way of promoting, promoting more, improving the socioeconomic implications for the environment and the family. Next slide. So breast milk storage guidelines. I noticed this is another question I get from mothers. Oh, how can I store my breast milk? If I leave it outside, is it enough? In the fridge? What? So this is like the guidelines we use if the breast milk is just left or in room temperature, you can leave it for about 3 to 4 hours, but it should be covered. It should be clean and all that. So you can leave it for about 3 to. But if you are in a very warm environment, maybe it's sunny, that's it has to be maybe within I'll use the lower limit, 2 to 3 hours. It should be consumed. But if it's a room temperature, just okay temperature, you can stay as long as 4 hours. Then if it's in a cooler bag, so a cooler bag is a bag that has packs. So maybe you're a working mother, you have to go to work and all that, to put ice packs in the cooler. That can last for as long as 24 hours. The breast milk can stay. And same with the refrigerator. If it's in the fridge, so the fridge, some people say it can last for a week, some people say 5 days in the fridge. But in the freezer, for the very deep freezers, you can last for as long as 6 months and 12 months. I'm sorry, I wanted to mention something on storage. You can storage. So once your breast milk is in the freezer, then you bring it out. Once it thaws, you can't refreeze it. So once your breast milk thaws, you can't refreeze it. So, and once it thaws, you have to consume it within 24 hours. So that's the point. So if you are not ready to use the breast milk, don't bring it out from the freezer and all that. Yes. So we can go to the next slide. So barriers to effective. So this slide just talks about some complications, barriers, different things to what is preventing us from having an effective breastfeeding. So I get a lot of, my breast milk is not enough, the baby eats. So there are many things that are responsible, and you should be determined as a mother. I'm not saying mothers that are not breastfeeding are determined, but you have to just, maybe if you know some of the reasons why this happened, okay, it is fine. So initially, in the first few hours or days the baby is born, like I said earlier, they eat frequently, and that they just eat small quantities and frequently. Then later there is what we call the growth spurts. Usually maybe like once they are like 4 8 weeks, they grow faster, and at that period they need to eat for they need to eat more. So just keep rehydrating, drink water, eat well, and you'll be supplying enough. And once you know your attachment is good, your positioning is good, you're breastfeeding on one breast, the other breast is getting full and milk is dropping, you're actually producing. So don't be worried that baby is not getting enough milk. And if you are going to the hospital, your baby is gaining weight, everything is fine, that should reassure you. Then another problem is the engorgement. So sometimes maybe we don't give the bread, the baby is not consuming as much as we are producing. That could also make us reluctant to breastfeed, but don't feel reluctant. You can still breastfeed that. So if your baby is not consuming as much as you are producing, you can express the milk out. You can use warm compress on the breast. You can also take some form of analgesia because it can be painful and all that. But that breast can still be given to the baby. You shouldn't stop breastfeeding because of that. Then it could be infected, mastitis. With mastitis breast, you you comment on antibiotics, but that breast can still be breastfed. You don't have to stop breastfeeding because of mastitis. But if there's an abscess is a collection of pus, the abscess will be drained and antibiotics will continue. Then once you can see, there's no obvious pus around the breast and all that, it is already healing, you can resume breastfeeding. Then another important thing is this retractile nipple. So it's advocated during antenatal, checking your nipples, counseling you on breastfeeding, the importance is something we're advocating, and that's still part of the team of this year, supporting the breastfeeding. So the health workers are now being trained to talk about breastfeeding during antenatal care, talk about the nipple, talk about positioning, already exist all these barriers, talk about them, how you store them. So your for retractile nipples, you're already aware that, you've examined your nipple. My nipple is like the inverted one or the retracted one, and you start working towards bringing it out and um making it available for the child, not when the baby is born and everybody is now struggling and the mother is frustrated. She just had a baby, everybody is tired. So those are some of the barriers to effective breastfeeding. Next slide. I think that's my final slide. I'm not sure.
Okay, yeah.
Okay, so thank you very much. I think
Okay, thank you very much. Thank you for that beautiful presentation. It was really, really, really power packed. Fantastic. I have learned a lot. I hope you're learning a lot as well. I would want you to please invite your friends, invite everyone around you to join us. And don't forget to send in your questions. Yes, our professionals are still here to take all of your questions. She mentioned something about the colostrum. I've heard so many things that, no, that first one that comes out, just, express it and throw it away. Don't give it to the baby. It's very poisonous. Yes, we hear that a lot. But thank you for the information. Thank you for teaching us, and I hope you're all learning as well. Thank you very much, Dr. Zainab. All right, Dr. Oluwatosin, are you ready for us? Okay, you have to unmute yourself. Sorry, I had to do that because there was a bit of interference. So if you will unmute yourself now.
I'm ready.
Okay, so are you ready for us, Ma? Should I bring on your slides?
Yes, I am.
All right, I
Yes,
hope
I
you're
am. You can turn on my
following.
slide.
All right, great.
First, before I start, while the slides are coming on, before I
Okay.
start, I must sincerely basically, Dr. Puela has done a fantastic job. He has really, spoken to a lot of things that I was going to speak to, which is sort of a good thing because it tells you that the information about breastfeeding is not divided. It is uniform. It is universal. The information is, there is no controversy about breastfeeding, about its relevance, its benefits. There's no controversy about it. So at least we'll take that as one of the reasons why the slides may be similar in some ways. But yes, but of course, I will try my best to bring some interesting things forward, and I hope that it will also be something that we can benefit from.
Okay. Okay. While we're still waiting for the slides, I don't know. My computer just froze suddenly, but it will come up.
Yeah.
Very quickly, Ma. Maybe I'll pass this on to Dr. Luatose.
Okay.
Um, People ask lots of questions. I'm taking some medications. Can I still breastfeed? Will this hurt my baby? Can I transfer some of these drugs to the baby? Or the baby's on a particular medication. Can I take that medication for the baby and then have the baby suck it from the breast?
Okay, the two questions
What's
are
your take?
different questions. For the first
Okay.
question, that's about mothers on medications, breastfeeding. It's always best that before starting any medication, you seek guidance from your physician, and particularly asking questions about if this medication is safe while breastfeeding, because there's so many, there are different medications. Some are capable of being, transferred in the milk, and some maybe just in very trace amounts and are not likely to cause any harm in any.
Very good.
Breastfeeding, but it's always best before starting any medication at all, confer with your physician and be certain that it is safe. Now, for a baby that's supposed to be on medication and the mom thinks that, oh, I think it would be better to take it and then my baby will take it from my breast, it doesn't always work out, because for babies, the dosage that they need it's something that has been determined by your doctor, and it's not predictable just how much of the medication is going to get to your baby from the breast milk. So
Okay.
if you are not certain, if you are there's sort of some confusion, or you're afraid, speak with a pediatrician. Let them allay your fears. If there's a real reason for your fears to be allayed, if it's a drug that should not be given to this, pediatrician will definitely advise you properly. No, we can't rely on using from the breast.
All right. Thank you for clearing the air of that. Thank you very much.
Yeah.
Dr. Zainab, if you'll unmute yourself and just take this question very quickly. Breastfeeding and alcohol. Can a mother take alcohol and still breastfeed? Okay, we've had questions about coffee, tea, and the likes, but particularly alcohol, cigarettes. What do you advise?
Well, I'll advise abstinence. No. So when you're breastfeeding, it is the advice is to stay away from alcohol, because there's no some amount of those alcohol will be given to the baby. So what some people say, the people that really want to take, they say, okay, so if I take alcohol now, maybe in the next 6 hours I can now breastfeed. But
Yes.
really, we can't really tell when the alcohol will have left your system. So my advice is to totally abstain from alcohol while you're breastfeeding. So for things like coffee,
Okay.
you could take coffee, but you could take it towards if you know when you are breastfeeding and that, you could take it like 3 hours before your next breastfeed, before the next breastfeed. But I know some people are kind of addicted, or let me don't use the word addicted, they love coffee. So that is when we give all those kind of advice. But generally, we just tell you to avoid it, because these things are not really cast in stone. When I say, okay, maybe 3 hours before your next feed, the coffee can still be there and it could have effects in the baby, makes the baby G3, palpitations, and all that, give the baby some other effects. So I'll just tell you to stay away generally. Then for
Exactly.
um
See?
the tea is fine. At least the Lipton tea is okay with milk. Cocoa drink, beautiful. So you could take tea with breastfeeding. That's fine.
All right. Thank you very much. Unfortunately, I'm still having a bit of challenge bringing up the slides. I don't know why. I might have to
Or
reboot
maybe can
verification, but
Dr. Ahmad share by on
can you
our.
share on your screen? Do you want to try, Ma? Dr. Ahmad, can you hear me?
Tosin, you have to unmute yourself.
Okay.
Okay, I was saying that I'm working on sharing the screen
On
if that's
sharing.
okay.
Okay. So while she's working on that, Dr. Zainab, I'm still coming back to you. Also, we're able to take questions from participants. Sorry about the glitch. I don't know what's going on, but I'll get that sorted. All right, mom. One question that people always ask: my baby is not getting enough food. My baby is not getting enough food. We can't measure the amount of breast milk coming out and into the mouth of the baby. And sometimes you see grandmothers, especially pressing the stomach. Ah, this child has not eaten anything. No, the stomach feels empty. How exactly can mothers feel comfortable that their babies have had enough breast milk for the period? We can't see the breast milk coming out. And we can the belly of the baby is not transparent.
Okay.
I'm so sorry. Can you
Okay,
see my
so
screen now?
not yet.
Okay. Let's see what's going on.
Okay, so that's a good question because that's a concern many mothers have that their baby is not getting enough milk. So I think during the part of my presentation, I said good positioning and attachment. And the baby's mouth is full of the breast and milk. You're sure the baby is swallowing the milk. You're hearing pokoi, pokoi, pokoi. So you know the baby is actually getting that breast milk. So how do you know the baby is full? The baby withdraws from the breast voluntarily. You're not the one that stops the baby from breastfeeding. So the baby voluntarily withdraws from the breast. That's one. The baby sleeps, has a good sleep, sleeps well from as intermittently after sucking and all that. Then while you are breastfeeding, as you are breastfeeding baby on one breast, the other breast is dripping. So you know, yes, your breast milk is actually getting to the baby. Then if you are still doubting yourself, like is this baby still getting, you could actually objectively express the milk into a bottle and feed the baby. So you can measure the milk. So there are milks for each particular age for baby. So maybe a newborn should take about 30 mils every 2 hours or every 3 hours. So you could actually measure out the milk and feed the baby and see how the baby responds. So that way I sure, oh, I actually fed my baby this amount of breast milk. It's like the moderator is out. So I actually
I'm
fed
back. I'm here.
okay. So I actually fed my baby this amount of breast milk and my baby is full. So, and as you go for your checks, there's a 6 week immunization. So 6 weeks and you are going to check your baby. The baby gains weight. So you know, oh, okay, my breast milk is kind of sufficient. So those are some of the ways in which, and your baby is your baby is stooling, making, so as they are for the first few weeks they have so many they pass frequent stools, so the baby is stooling, then later it now becomes normalized. So when your baby is stooling, the diapers soaked with urine, so you know, yes, my baby is having enough. So if you don't have those, that's when you can be doubting if you're not changing your diapers frequently, you're not making so much stool, and say, oh, is it enough? Is it? But when you're changing diapers frequently in a day, you're having 4, 5, 6 diapers, you're stooling, those are signs that the baby is having enough.
Enough to eat. Okay. Thank you very much for that. Okay. So Dr. Oluwatosin, can we have you now?
Yes, is my screen showing? Is it sharing now?
Not yet. Okay, let me add this term.
Yeah,
Okay,
it is.
it's sharing.
So it's sharing now.
Yay. Now is how to okay, let me just see if
Okay, let me
I
try.
wanna
I've been
okay.
able to reboot, so let me try.
Okay. I wanted
Let
to
me
just see
try.
if they're moving. They're moving right now.
Or do you want to go on with that?
Yeah, I just want to be sure that the slides are actually moving as I go along.
Moving.
Yeah.
Okay, so
So
you can
is
go
it
on. You can go on. If you will
okay?
expand for us so that everyone can see.
All right. Okay. Do you have it expanded
Great.
now? All right.
Yes,
Fantastic. Yes, we do.
it's fine.
Awesome.
Okay, good evening, everyone, once again, and thank you for having me. I'll be talking about breastfeeding, but I'm going to have to um, run through some slides very quickly because my colleague has already touched on those and she has done a very great job of explaining those. But I'm starting off with this slide, this definition slide, and there's some things that I wanted to highlight here. That optimal breastfeeding. And optimal breastfeeding essentially is speaking to the whole sum of what constitutes the best form of breastfeeding, best way to breastfeed a baby or a newborn up until they are grown. And the first part of it is early initiation of breastfeeding within the first hour after birth. I I'm speaking to this because in the discussion about exclusive breastfeeding, sometimes this aspect is missed, and it's important to highlight this because there are several benefits that come from early initiation of breastfeeding that are sort of they're not the same as the benefits that you get from the exclusive breastfeeding itself. That early initiation of breastfeeding, that's starting off in the first hour after birth, it promotes bonding. It's the first contact the baby is going to have with the mother. Number two, it promotes what they call it, temperature control, better temperature control in the baby. And we know that better temperature control in the baby, once the baby is warm enough and gets warm enough on time, that after being born, it has so many benefits. It saves the baby the risk of infections, the risk of having challenges with their metabolism, risk of dying. It's a very beneficial thing for the child to achieve that warmth very early and very quickly within the first hour of life. And then, of course, this also sets the pace or the tone for successful breastfeeding, because once the baby starts to suckle within that first hour, the mother's body is primed, and the mother's body recognizes that, yes, the baby is here, I need to start making milk. And that can help to reduce the delay, because sometimes when babies are not put on the breast at an early within that first hour, you find a situation where mothers are not lactating until 3 days or thereabout after the baby has been born. And because of that, they are now at risk of having to use things like glucose water and food formula, and just other things that will prevent exclusive breastfeeding. The next phase of this is what we've talked about extensively. That's exclusive breastfeeding until 6 months of age, then continued breastfeeding up to 2 years of age or beyond, along with timely introduction of safe and adequate complementary foods. This is just to speak to the fact that breastfeeding is a universal right. It's actually a fundamental, I think it's a fundamental right, because it helps to protect the children. It gives them the best start they can possibly have in life. The benefits of breastfeeding, there are benefits like Dr. Okwola has discussed. There are benefits that benefits to the baby, benefits to the mother. There are also benefits to the family and the community, and there are benefits to the nation. And in line with the breastfeeding week goal, or the breastfeeding week theme for the year 2020, that speaks to supporting breastfeeding for a healthier planet. In whatever the benefits that come to nations as a result of breastfeeding are crucial in ensuring that our planet is healthy. So we've talked about it being the best for baby in terms of providing the right amount of nutrition, right amount for baby, building the bond between baby and mother, which has a positive impact on the child's speech, development of speech, the child's behavior, and the interactions as the baby grows. And we've talked about all other things like the immune system, non-communicable diseases. Now, an exclusively breastfed child is 14 times less likely to die in the first 6 months
Wow.
of life,
Wow.
as compared to a non-breastfed child. And
Child.
these
Yeah.
statistics are real. These are not made up. This is
Wow.
what we see, and we are faced with as pediatricians on a daily basis. We find children who, as a result of non-breastfeeding, replacement of breastfeeding with different things that are not beneficial to the child, cannot help the child. These children end up being, they are not just not just malnourished, but their immune systems are not well developed, and they cannot cope with infections. They can't cope with these illnesses, and this is why their risk of dying is higher than those who are exclusively breastfed. Now, an exclusively breastfed child is also more likely to have better educational achievement at 5 years of age. I know some mothers will say, this one now, this one, but my child is smart. Yes, we agree. Your child is smart, but these are the statistics. It is clearly proven that children who are exclusively breastfed, they do better educationally by the age of 5 years. Dr. Paula has done a great job talking about the benefits to mothers. I would say that a healthy mother, as in breastfeeding, also helps to promote maternal health. It helps to reduce the risk of postpartum bleeding, which is a significant cause of death, maternal mortality, death in mothers, and anything that can reduce that risk is a great benefit. It also helps to manage, and mothers who are breastfeeding are less likely to have postpartum depression. It's also a great benefit for our mothers. And for families and communities because of the massive cost savings. And I said this here in the slide that many families in Nigeria are one bad decision away from poverty. And in this instance, the decision to breastfeed or not to breastfeed can be one of those one of those crucial decisions that can take you either into poverty or out of poverty, at least hanging away from poverty. Right? And I started to break this down into the direct costs of not breastfeeding. Now, most of us are familiar with the different types of um, formula feeds that are on the market and the average cost for a formula feed, based on what Dr. Okuola has said, the universally accepted frequency of feeding and the universally accepted quantity per feed, stating that children, newborn babies should be fed between 8 to 12 times a day. And this frequency reduces over time, but there are times that even that 8 to 12 times a day increases during their growth spurts. This means that a newborn baby is going to run through a can of formula in 3 days. And looking at these projections of cost, per month, the family will spend nothing less than 30,000 on artificial formula. That's for a family also of artificial feeds. This is for a family who is spending money on formula feeds. This means that they're spending 30,000 naira on formula. And if we're in the context of the economy that we live in today, that is a significant sum. That amount of money can go into other aspects of family care, preventing illnesses, ensuring education, adequate education, ensuring food and appropriate nutrition for other members of the family, and so on and so forth. The indirect costs, they are costs that by the time we start to add it all together, prevention would be way cheaper than cure. Cost of hospitalization for all the illnesses that non-breastfed or suboptimally breastfed children are at risk of, treating infectious diseases, cost of treating chronic non-communicable diseases. These are, for example, the cost of care for, let's say, I would use asthma. Asthma, for instance, a child who develops asthma needs to be on controller medications and will need to buy them every month, a refill every month. And the cost of these refills sometimes range go up to 5,000 naira, even above 5,000 naira. For a family that is also, you have other dependents and they need to take care of, these are significant costs by the time they add on. And then in the event that such a child requires hospitalization, these costs continue to add and take a significant toll on the family. Now, in the context of the Nigeria that we live in, 46.7% of Nigerians are classified as being extremely poor. And the current breastfeeding rate, exclusive breastfeeding rate in Nigeria, is 28.7%. Now, it is an improvement based on the indices from 1990 to 2010, where we had less than 20%, and then the number went up to 21%, and currently we're 28.7%. But what does this really mean in actual numbers? It means that if we have 10 women, 2 to 3 of them, let's say 10 nursing women, 2 to 3 of them are exclusively breastfeeding, and this is not. This can be better, considering given the circumstance that we are in. And you see this cycle, it's a vicious cycle. It continues. Suboptimal breastfeeding leading to poor families, poor communities, and a poor country. Now, this is just to buttress what I've said about how the monies that are being used for substitutes can be used better, utilized better to ensure education for other members, improve sanitation and sanitary practices, ensure better access to food and water, and health and preventive care for other family members. So, a family in which there is an exclusively breastfed child, because this child is less likely to come down with illness and disease, there's the reduced chance of lost hours, lost work hours, lost work days, lost school hours, lost school days to hospitalization or disease. The national benefits are very significant. Breastfeeding is crucial in poverty eradication. I have highlighted and I've discussed in the last few slides. Crucial in poverty eradication. It is in a country in which the indices for breastfeeding are high, will see an improvement in the under 5 nutrition indices, children who are malnourished, if in countries with high breastfeeding coverage. And then there will be significant reduction in mother and child deaths. And resources can be made available, all the resources that we're trying to tie to tackling malnutrition, tackling this, tackling that, because of the low breastfeeding coverage, can be used to ensure improved childcare in other aspects of child health. And at the end of the day, this would give rise to a healthier nation and a healthier planet. Now, are there babies that cannot receive breast milk? This is a very rare situation. In fact, it is very, very rare, very, very rare. And so that means that almost every child, and when I say almost every child, I'm saying like over 99.9%, over 99% of babies can have breast milk, and it is not a challenge. So based on these things that we've said, all the benefits, the national indices, the poverty indices, everything, and how breastfeeding takes to health and general economic improvement, economic benefits. Local girl is very confused about we're not exclusively breastfeeding. Why are the indices still so? So I had to look deeply and just say, I'm not going to assume. Let's see what the information, according to body of work that has been done by WHO, UNICEF, and different organizations, concerned bodies have done, what they had to say about it. And I summarize this as follows. This is Exit 1, sociocultural practices. Now, in this slide, meet grandma running over. Over meaning that it has to be enough. There's no reason for food not to be enough. And she's here on Omugwo for her first grandson. She's always complaining that David, her grandson, is not getting enough breast milk. And she insists that her daughter should give David, whether it's water or pap or formula or agbo. And she says to, push home that message. She says, I did the same thing for you. all of us did the same thing. We did, and she says this all the time. Now, these practices, social cultural practices, have played a crucial role in or they have constituted a significant barrier to exclusive breastfeeding, and this is very rampantly documented. Sorry, I'm not trying to castigate the grandmas, but this is a real situation. I'm sure a lot of mothers can relate to this, that what they'll be told is that, please, my child cannot starve, my grandchild cannot starve. Now, the second situation is this aggressive infant formula marketing situation, where we know that breastfeeding is so beneficial, but we're seeing that many more companies are making infant formula. Many more companies are selling infant formula despite the presence of a code. And it's because, by and large, there are weak regulations, and also sometimes because some health workers, while trying to seem well-meaning, are also, weakening the resolve of mothers to breastfeed by encouraging them to say, okay, just take the formula. Don't need to, this thing is just suffering. The reality is that breastfeeding is a marathon. It's not a sprint. It is too new. Sometimes the baby is new. The baby is learning, and it will come with its own learning curves. But the benefits outweigh everything, every single thing. So this is one of the reasons why there's this challenge, or one of the barriers to exclusive breastfeeding. Now, this third exhibit is about poor breastfeeding preparedness, and this is to speak to the fact that many times the first time a mother is faced with the reality of breastfeeding is after she has given birth to a child. Then she realizes that, oh, I need to breastfeed, or I have to breastfeed, and she's not prepared for the process of breastfeeding. But what that means is that the curve becomes harder. Trying to cope with breastfeeding can become harder. So lack of education about breastfeeding and its benefits before and during pregnancy, near absence or absent support systems to promote exclusive breastfeeding. And by this, I mean lactation consultants, trained midwives, trained community healthcare workers. Now, how can you help? Because it's crucial that everyone plays their part in ensuring that exclusive breastfeeding becomes the norm and it's no longer the exception. So some of the things that come by way of suggestions are: one, learn more about breastfeeding. It's like I said, as I've highlighted in this presentation, it is a marathon. It's not a sprint. It's something that you need to get prepared for even before you get pregnant. You need to learn about it, just as you learn about many things, new things, as in you learn new things. Breastfeeding is new. You need to learn about it as well. So online resources, books, speaking with pediatricians, that will also help. Now, for those who have experience with exclusive breastfeeding and they came out of that, it was successful, they can become breastfeeding champions. They can teach other mothers about breastfeeding. They can provide support for nursing mothers in their communities. They can help in even developing support groups for other nursing mothers. And the third part is to invite grandma for antenatal and breastfeeding classes. It's very important, not just grandma, but because of this social part of breaking these social cultural practices, bringing in those who have been used to the social cultural practice, and let them see that these children, they stand to gain so much, the community stands to gain so much, the world stands to gain so much by making sure that this child is exclusively breastfed for 6 months and then get optimal breastfeeding for the rest of for up to 2 years and beyond. So it's not just grandma, even the fathers, any form of support system that is going to be in place during and after the delivery of a baby, they need to also learn about breastfeeding. They need to be taught and be informed about breastfeeding. So with that, I have come to the end of my presentation, and thank you for listening. We can take up questions now.
Thank you. Thank you very much, Dr. Oluwatosin. That was, I mean, that was very, very educative. Coming from a doctor, you have gone into economics, you have gone into finances. I really, I must confess that nothing beats exclusive breastfeeding. I can testify to that. I have two kids and I did it for 6 months. I mean, it was not easy. It was not easy. Sometimes I get discouraged, but I must tell you, I look at my kids and I say, really, it is worth it. And I saved money. So take a cue from that. It's
Yes.
very, very important. All right. It's still breastfeeding week, and we're celebrating our mothers and our babies this week, and the
Yes.
breasts that are breastfeeding the babies. How can we care for those breasts? Is there any special thing we need to do? Do we have to clean them before we start breastfeeding? Do we need to massage them? Do we need to, I mean, is there a particular kind of bra that will help, to lactate better? Or is there a special sleeping position? What exactly can we do physically? We've heard about educating ourselves about breastfeeding, but what are the physical things that we can do as mothers to help ourselves, lactate better
I'll
and
speak to
breastfeed
some of those
well?
things, and I believe that Dr. Paula would. There are definitely some things that she also wants to say as well. So I'll speak to a few of the things. So the first thing is that mental health of mother is very
Okay.
important. Mom needs to be in a frame of mind where she knows and she's willing to breastfeed her child. She's happy to breastfeed her child, because breastfeeding is from the brain. That's the interesting part. It's not, it's the body is just acting based on what's going on in the brain. So
Remembering,
as
yeah.
much as possible, mother needs to be in good health and her mind needs to be open to breastfeeding the child, happy to breastfeed the child. That's one thing. The second thing you touched on, and then yes, there's another thing, pain control. Pain has to be as down as possible for mommy to, it's part of getting mothers comfortable to breastfeed. The second
Okay.
thing is, you talked about breast care. Breast care, it becomes important, particularly in the climes that we live in. We've talked about mastitis, talked about engorged breasts, we talked about how to prevent those and treat those. There's also the aspect of ensuring that the breasts are clean before feeding. A bath is usually good. It's usually sufficient most of the time. But in a mom that knows that, okay, maybe I've had a really sweaty day, I need to just try and clean. Do whatever you know that you need to do to at least make sure that your breasts are clean. But usually a bath is usually sufficient. Um, then the third thing, or the other part of breast care, because our environment is so humid and it gets warm sometimes. Some bras keep trap so much heat um, in the breast, such that some mothers come down with fungal infections and quite painful. Not our mastitis, not but those fungal infections can be quite painful, and they may be deterrents for breastfeeding. They won't want to latch on because it's so painful. So in that, guys, every bras can be better. In fact, they are better to prevent that. And also, as much as possible, when you let's just allow air circulate around the breast, avoid moisture, too much moisture. So if you need to, your breasts are not too, there's not much wetness around the breast, that can also help prevent those fungal infections. So I think that's where I will stop, and then Kola can speak on this as well.
Okay. Thank you. Dr. Zainab, do you want to add something to that? You want to add something to that? Please just unmute yourself. Sorry, I have to be going back and forth to the muting and
Okay,
unmuting.
no, that's fine, okay. So Tosin has said a bath is fine. A bath for the day is fine. You just be clean, wear clean underwear. But we have nursing bras. You can't wear regular bra. Regular bras won't really be nice for the breast. Like Tosin said, you could have some pains around aside from mastitis and engorgement. So nursing bras have a way of making the breast balanced in the bra. So I would advocate for nursing bras for nursing mothers. You can't be nursing and you wear the typical bra that has the iron underneath and everything. So you should wear a nursing bra. So that's the only thing I will add. Then the other things for breast, well, this is not breast care, but things that will help to increase breast milk hydration. You have to drink lots of water. You have to drink lots and lots and lots of water. So that's another thing that will help the milk. And you have to eat well, balanced diet. So you can't not be eating and be expecting. So you have to eat well and be well hydrated. So those are the things I will add in addition to nursing. But then before you breastfeed, you just the normal general hygienic things. Wash your hands. Should be a routine. Even if you're not touching any bottle or anything, wash your hands. Just because you're going to touch the breast, you're going to touch the baby's mouth, and so you have to wash your hands. And I think you're good to go.
Thank you very much. All right, it's still Breastfeeding Week. It's still our live symposium on ATP on Breastfeeding Week 2020. All right, so keep your questions coming in. Our doctors are still here to take all of your questions. All right, so I have one question here from, okay, Bata. Okay, does detox with lemon affect the weight of baby when he or she breastfeeds? Okay, she's asking who would like to take that. Dr. Zainab?
So
Okay,
I
can you
get
unmute
well.
yourself? Okay.
Yes, I have. So I've heard about this. Oh, I'm taking lemon. How is it for my baby? Oh, and all that. So, in everything which there should be moderation. So if you are taking some form of lemons, one or twice a day shouldn't affect your baby so much. It's a citrus fruit and all that. So it shouldn't affect the weight of your baby when he or she breastfeeds. But in everything we do, there should be moderation in how we do it. You shouldn't take so much lemons in the in trying to detox and all that. So you could take a few, because everything you eat actually goes to the baby, and that's it's a very it's not really clear cut in the books, but it's something I've noticed. So your diet affects the baby. If you're taking things that are maybe vegetables, beans, things that will make you like citrus fruits and all that, it makes the baby, it goes to the baby, and it can make the baby increase stools and make the baby pass a lot of stools. If you're taking core carbohydrate diets, bread, yam all the time, it gets to your baby, and somehow your baby is not stooling. And I asked, what are you eating? Is it bread you're eating every morning? And yes, the doctor, is bread. Oh, that is it. So everything is in moderation. Whatever thing you're taking, it affects the baby, but not necessarily weight per se, but it just affects the baby in some ways.
Thank you very much. All right, the questions are coming in. Let me take this from um Fare. My baby is
Okay.
5 months. Sorry, I didn't call that well. My baby is 5 months. I'm breastfeeding very okay. I'm breastfeeding every option, but it's I can't seem to get this
Okay,
question.
she's getting fat while she's
She said she's getting
breastfeeding.
fat. Yeah.
Oh, I'm getting fat.
She
Why?
said
Okay,
why?
because generally they say you lose weight when you're
Yes.
Yes.
breastfeeding.
Yes. The general consensus
Okay.
exactly is that it helps you to lose your pregnancy weight.
Wait.
So it helps you to shed your pregnancy weight faster. Yes. However, if you're it's that's where part of the myth of around breastfeeding, some of the myths come into play. Some people will say, oh, you're breastfeeding, you have to eat a lot, you have to eat plenty so that you have enough for your baby. But the truth, the reality is, number one, you don't need to eat much more than your typical requirement. If you have to eat anything in addition, somewhere around 500 calories, 700 calories, but not exceed that. Unfortunately, part of some of our practices, well, I won't say unfortunately, because let me just say the reality is that some of the foods that new mothers are asked to eat during the omugwo phase, bearing phase, some of them are quite calorie dense. Like you're asked to take pap every morning, pap with milk, pap with this, pap with that. Pap has significant amount of calories. Add on the sugar, more calories, milk, more calories. So I'm not saying don't eat. What I'm saying is don't overeat. Don't be excessive. As in, don't if you exceed your caloric requirements by too much, you certainly will gain weight, and that is the reality. The breast milk will go to the baby, but you will still gain weight. The second part is this: most times when mothers are breastfeeding, they are not so active. They are sort of almost sedentary during the first few months or thereabout. They've not resumed work, activities haven't kicked in. So by and large, you're moving from one room, from your room to maybe the room where you're going to breastfeed, to the kitchen. So it's not a lot of work. And definitely your metabolism recognizes that you're not working so much. So the tendency is that if you are eating more than you're burning, you're going to have some some added weight. That's just the reality. But it can be helped. It's not something that, and it's not something you should be so afraid of. Recognize the first steps are to identify the things you're eating, see where you might be eating much more in terms of calories, streamline it down. Make sure you don't cut back on your water. You need your water because you need enough fluid to produce enough breast milk. And then you can pick up with activities. Since it's only about 5 months, there's probably more strength to do a little more um, before the baby goes to 5 months. So you can pick up some activities, you can start some exercise, those kind of things, and they will be helpful. I think that should help.
Thank you very much, Dr. Luatosi. All right, while the questions are loading, I have a question. Like, for instance, if a mother has just given birth and she's yet to lactate, okay, they say put the baby to breast. The more the baby sucks, it helps to send the message to the brain and then the milk will come out. Okay, day one, nothing. Should we leave that baby hanging? Or what's the best thing to feed the baby with? I remember someone saying, give the baby glucose and water. I mean, what do you advise? Dr. Zainab, I think you should take this. What do you advise? What can we give the baby for the first few days before the mother starts producing milk?
Okay, so how are you sure the mother is not lactating? Let me start from there. Because everybody say we're not lactating, we're not lactating. Like I said in my presentation, the first few days, the baby really needs something small. We don't need a lot of milk. So we eat frequently, but we are just taking something small, 10 meals, 20 meals. So that's the first thing we should clarify. How are you sure we are not lactating? But in as much as we don't want to starve the baby, we won't want to starve the baby in any way. After we've explored all the possibility of making sure the baby takes breast milk, colostrum in the first few hours, if nothing is coming, we can use breast milk substitutes. So, but we should avoid glucose water, because I know that's what some people do in the maternity homes, and also glucose water comes with its own problems and complications. So you could buy one of the breast milk substitutes and use, but we run away from breast milk substitute because by then the mother has this sense that my baby is eating, so she's a bit relaxed. The baby is already used to the formula milk that is easier to take, because breast milk is actually harder for the baby, because baby will have to suckle a little before the breast now finally gets into the mouth. So, and babies too, as they are born, they are very smart. When you give him the formula, and this one is entering sharp sharp, so that's what you call nipple confusion, and he now gets to the mother that this one is hard though, I have to, so you see he would have started rejecting the nipples. So we just encourage. And I want to use this opportunity to say, because I might get the question that, if the mothers have CS, so what should we do? Because CS is another reason why people start breast milk substitute. Having a cesarean section, I know the mother is in a lot of pain. I know there's pain and all that. But like Dr. Amon said, it has to do with the mindset and preparation before the baby is born. Our minds are very strong. Once you've made up your mind that I want to do this, that strength will come when you are coming out of the theater. And these days, we don't even do general anesthesia. It's just spinal. So you're awake, and you might just have a pain from the surgery site and all that, but you're awake. So, that I just want to put my baby to bed. Sometimes the nurses can say, you just had CS, rest. But when you are shouting, give me, I want to put my baby to, Tosi, I beg, give her a baby. And and you initiate lactation, like Tosi said, within 1 hour. Once you start that and you continue, it sends the message to the brain and the breast milk will come out. And this is not just talk, say, hey, the doctors are saying. I've seen personal experiences from people doing this, even close relatives. My sister is one of them. I can remember when she had her baby, she had a cesarean section. And within, when she was out of the theater, 30 the people, they were already making the breast milk substitute. Yes, let her rest. No, my baby, like the nurses were this mother, and she initiated lactation. So it has to do with mindset and your preparedness before. I know some people actually have difficulty lactating, maybe flat nipple, retracted nipple, and all that. But all these things should be before the baby is born, like Tosin really emphasized. Once we deal with that, by the time the baby is born, most of those challenges will be overcome. But in as much as we are promoting breastfeeding and all, because there are still sometimes, God forbid, maybe the demise of the mother and all that, you might need to use breast milk substitutes and
Okay.
that's
Thank
yeah.
you very much. Thanks a lot. One thing I have picked is just make up your mind. It's a mindset thing. If you really make up your mind and you decide you want to breastfeed, trust me, you can achieve it. It's not easy, yes, we know, but trust me, you can achieve it. All right, keep your questions coming. We're still here. We're still taking your questions. It's ATP Live and 2020 World Breastfeeding Week. Okay, Dr. Luwatosi, let me take this to you. My baby is on exclusive breastfeeding. But my baby has not pulled for more than 1 week. What's going on? Is this baby healthy? Is baby taking enough food? I mean, anybody that eats must pull. How come there is no pull? What's happening?
Okay, the first thing is whenever that question comes along, I premise it on when it is happening. So the first thing I ask is now this baby in question, has this baby passed their first two? If the baby has passed their first two, that brings down the level of concern a little bit. The next thing I ask is has this baby had a different pattern of stooling, of passing stool before now? So if baby, this is the first week, baby has, as in had the passed the first meconium, and right now baby has not passed, so baby is still trying to figure it out. I usually would advise that give the baby 7 days. Just give it, because once they have passed that first meconium and you're just waiting for the next thing, give the baby 7 days, because the first thing is this: the breast milk that the baby is getting is small, usually quite small in the first few days, but it's sufficient to get the nutrients that they need. Usually, it's what's left behind, the waste of it that comes out as stool. That's the first thing. The second thing is that for newborn babies, their digestive system is still adjusting. They haven't quite figured out many things yet, but breast milk is the best for their digestive system. It's what is the easiest for them to tolerate and to digest. Now, if after all of that, we said this, that 7 days baby has not passed, so please bring the baby to us. Let us see your baby. But if the baby is feeding well, has passed their first meconium, is urinating, the tummy is fine, is not uncomfortable, but has just not passed the next two, is usually the advisory time not longer than a week, 7 days after. And then if that's still persisting, baby needs to be seen by a pediatrician.
Very much. Thanks a lot for that. Okay, so I have a question here.
Okpa, can you hear me? Okay, maybe I should just go ahead with the question. Tosin, can you hear me?
I can hear you. I can hear you.
Okay, so maybe I should just go ahead with the question. So Oluwatosin Fagbemi says, aside from the aforementioned ways to help lactate, is there any other thing one can do or eat to help? I drink lots of fluids, position baby well. I also eat well, but I find it difficult to express milk. I don't have any nipple challenges too. My other question is on lactation cookies. What effect does it have on breast milk supply? Thanks. Okay, so um there are some lactation cookies now. There's this seed that is called fenugreek seed. They said it helps in milk production. So so it depends on what the lactation cookies are made of. Some are made with oatmeal, some fenugreek seeds, and even these fenugreek seeds you can make them as tea. You can drink them as tea, or they can come as lactation cookies. So they help. They actually help lactation. They help some people to produce more breast milk. So they're actually local foods that they said that it's said to improve milk supply. There's this thing they call semia. I'm trying to tamarind. I think tamarind seed. You can make it like pap, and they said it helps to produce breast milk. Even tiger nuts, yes, tiger nut drink. I think so. Some people say it helps. So if there's no harm trying, if it's lactation cookies, you could try to make it help you produce breast milk. So that's on lactation cookies.
Thank you for that. Another question here. This is from Adeshola. Thanks for the lecture. I noticed the part of my breast had like a ball. It wasn't there before and during pregnancy. I massaged with hot water. There was no changes. And when I visited the hospital, I was told to come back 6 months of after 6 months of breastfeeding my baby. Is this normal?
Hi. According to that, one of the things typically that a condition that would typically present like that, having some balls in the breast during lactation, like lactocils. But once you massage them with hot water, typically, or warm water, typically they should reduce in size. Now, from what has been described, it doesn't sound like a lactocil because you said with that therapy, the ball is still persisting. I would strongly advise if you need to, you might need to get a second opinion on it because we don't want something that you can easily you should get tested or get a second check or maybe a scan just to be sure this. It may not be x-rays, it may not be mammogram, but just a scan, just to be sure that there isn't anything to be worried about. Yeah.
Okay, thank you for that. Okay, this is from Zabir. My 14 weeks baby sucks well, and when she's weight is 5 kg. Is that weight okay, or is there any particular meal I should take? Okay, this is an incomplete question. 14 weeks, 5 kg. We don't know the best weight, but doctors, I mean, over to you.
All right, Okwe, being an ATP moderator, you know all the basics. But we don't know the birth weight, so we can't say how well this child has grown. So we can't just because if this birth weight was 4 kg, 1 kilogram in 14 weeks isn't good enough. But if this baby was weighing maybe 2.5 kg and has doubled by 14 weeks, I think that is very good enough. So everything is relative. And if you're sure she's eating well and all that, there are some babies that are not just big babies. And that's like one of the benefits of breastfeeding. Breastfeeding just gives your baby the optimal weight for the baby, no predisposing to obesity or all that. So if you are sure the baby is lactating, and when you go for your checks, you plot the baby's weight on the growth monitoring chart. So when you plot the baby and your baby is gradually growing on that trajectory, so far as it's not less than the 10th centile for that age, and it's just between the 10th and the 90th centile for the age, and it's growing along that curve, not falling off. just growing along that curve, your baby is fine. Even if it's on the 30th centile, fine, it's on the lower, but it's not everybody that can be on the 90th centile and the baby is taking the breast milk and all that. Some babies are just not big babies. Your baby is fine. So that question, like Okwe said, is not, we can't really give a definite answer until we have all the parameters. Okay, this is Tosin's question. Can you restate how breastfeeding
Yes.
overseas the country?
Okay. So it's a myriad of things. I just touched on one of the ways in which breastfeeding can actually help in eradicating poverty. And the part I touched on was direct cost of breastfeeding, direct cost of not breastfeeding. That's using, and in that instance, the use of supplement, use of formula, recognizing that for a child who is eating properly, who is as in feeding properly, that child taking 8 to 12 feeds a day and on formula, that child will run through 3 tins of formula in a week. And an average cost of formula is around, some of them are a bit maybe cheaper, some of them are more expensive, but we're talking around 2,500 per tin. So that's 7,500 a week. And when you do the multiplier effect on that, the family will spend around 30,000 naira a month just to buy formula feeds. We're not talking about the bottle. We're not talking about the amount of money they spend on gas to boil the water or whatever they use in getting the water to. We're not talking all those things in addition. But all those things are in terms of costs. And then that a child who is not exclusively breastfed is at higher risk of coming down with infectious diseases, childhood killer illnesses, chronic diseases, chronic non-communicable diseases that are also costly. They are quite expensive to manage, particularly in an environment like ours. A family who is just on the brink, just sitting around the edge of poverty, can be tipped right into poverty by not breastfeeding their child. And the cycle continues. Once the more expenses are going down the drain for health, not enough to ensure education that will promote the future of the the generation that is coming, not enough money to feed the other members of the family. At the end, it's a vicious cycle and it perpetuates poverty. But exclusive breastfeeding, and currently, like I highlighted, 2 to 3 out of 10 nursing mothers are breastfeeding, exclusively breastfeeding in Nigeria. If those numbers can go up, I think we will see a multiplier effect on the costs to the families, costs to the communities, and the cost to the country at large. So that is how I had that, the way I highlighted breastfeeding as a key to eradicating poverty. Now, the second question I'm seeing is, are grandmothers also involved in the breastfeeding? They can be quite involved. I'm sure that many mothers can testify that, in fact, part of the, it depends. If you have a grandmother who is all for exclusive breastfeeding, who had that practice handed to her, then you have a strong support. But for some mothers, especially our new generation mothers who had formula in their time, they will even tell you the name of the formula. That go and buy that formula. This child is not breast. This child is not gaining weight. This child is, go and feed my child. So we have that experience as well. They are quite involved. And that is why it's important that they should be carried along in the education process, whether during the pregnancy, and even when the decisions are being made after the delivery, pregnancy, after delivery, they should be carried along. They should be made, as in they should be taught, counseled, educated, everything that we need to do to help them support mothers to exclusively breastfeed and succeed.
All right, thank you very much, Dr. Watterson. I think Dr. Zainab has answered this. Are there meals that help in
Okay.
enriching breast milk production? I think we've
Yeah.
been able to answer that. Okay.
So she says,
Since I'm on exclusive breastfeeding, but I only feed on one particular breast, is there any problem with that? In fact, there is no milk in the second breast again. How do you know? Who will take this?
Okay, so well, if I understand the question, is it that the milk just she's producing milk from just one breast? That I'm not.
Okay.
I don't think I've come across that kind of situation. Or is it that she's comfortable with one breast, which most people are usually they are more comfortable with a particular breast, maybe because of the positioning and all that. So I'll just answer. I'll just talk about using both breasts to breastfeed. So um, it's usually advisable for the baby to be on one breast, empty that breast, so that the baby can even get the hind milk, the milk that has the fats and all the nutrients that will help the baby grow and all that. Because the first few milk type, the first milk that comes out is usually the fore milk, which is just water. And that's where you don't need water to give, you don't need to add water because the initial milk that comes out is water. So you don't need to give extra water to the milk. So you let the baby feed on one breast and empty that breast. As the baby is feeding on that breast, if the baby is actually getting milk, the second breast is getting full. So sometimes the second breast is even dripping of milk. So when you are done with that breast, the next time you are going to feed the baby, you can feed the baby on the other breast that is already full. So just try to alternate your breastfeeding. So don't stay on one particular breast. So you should try to feed on both breasts. So you feed on one breast, empty it so that the baby can get the hind milk and all that, the nutritious, the one that has the fats and will make the baby grow. Then switch over to the end. By that time, the other milk is full and engorged. Then when the baby wants to feed next, you feed on that breast. And for some women that lactate well, there are some women that really lactate. By the time the next feed comes and both breasts are engorged, you can actually express some of the milk and keep in the fridge or the freezer. For times when you go out, when you start working and all that, you could start saving up the milk in the freezer. So someone asked that, okay, what causes retracted nipple? So retracted, well, some nipples are just like that. We like to say that's how they were created. That's just how the anatomy of the woman is. So if you bring different women with different body parts, we all have different shapes, and God created us uniquely. So the nipple being retracted is just a different way of it's just a way of how your nipples are. So some people's nipples are retracted, some are flat. So it's just flat, and some are actually pointed. So it's the way God carefully created us in our own unique ways.
All right, thank you very much for that. So I think maybe Dr. Luasosin, do you want to take this? What happens in a situation where baby stops breastfeeding on our own at 5 months? You have to unmute yourself. You're yet to unmute yourself. Please unmute yourself, Dr. Luasosin. Please unmute
That
yourself,
sorry
Dr.
about that.
Luasosin.
The network got it
Oh,
just froze for a bit.
okay. Okay.
So
Okay.
what happens in a situation where baby stops breastfeeding on her own at 5 months? Well, we've reached a crossroads here. I don't want to ask
The story is
even if we
behind it.
ask the why, what could have happened and all of that, it didn't change the outcome. Baby is now here. What we can do to make sure that the child still gets the benefit is we can express. We can express the breast milk and offer it as expressed breast milk, and be prayerful that baby will accept it. Most babies who are refusing breast direct may just be happier to take the bottle, maybe because it's easier for them to take and not struggle and pull out the milk. So baby might accept them from the bottle. So I think that's an option to explore
Okay.
if baby will not stop.
Thank you. Maybe you take this very quickly. Is it true that breast milk
Okay.
causes oral thrush?
Ah, Actually, quite the contrary. Breast milk does not cause oral thrush. What we are afraid of is formula feeds and bottles. By the time the bottles, the teeth of the bottles are not well cleaned, they retain some germs. The formula feeds have enough sugar to promote growth of fungi in the mouth, and if the environment is favorable, the child can develop oral thrush, but not usually the case with breastfeeding. The only other that I've seen that happen, one time I've seen that happen was when the mother had a fungal infection on her toe. And I weren't sure which one came first, whether it was that the child had thrush, and then, but it was more likely that the infection started on the nipple, and because the baby was constantly exposed to the fungal infection, the child then developed thrush. Because it's not usually the case. Babies that have thrush, we have to consider several things. Is the baby on formula feeds, getting some form of sugar that is promoting the growth of this um, fungi, or is there an infection that is going on in the child predisposing the child to fungal infection?
Okay, thank you very much. There are so many questions, but our time is far, far spent. Maybe we'll just take two more and then we'll wrap up very quickly. Okay, I want us to take this from Olaya. Good evening. Thank you for this. Please, can a grandmother breastfeed the baby?
I
This is okay. Does
like
Tosin
the
want to
question.
add on?
Okay, you
Okay.
have answer if there's anything else.
Okay. This is a very interesting question, and it's something we've been discussing lately, funny enough. So, there's what we call wet nursing. So that's when it's not the mother that is actually breastfeeding the child. So another woman that is not really even biologically related to the child can actually breastfeed a baby. So a grandmother breastfeeding the child, yes. The answer is yes. A grandmother can breastfeed the child, yes. Scientifically, yes. Because like Tosin said, it comes from the brain, it's hormones. Once the child suckles to the breast, all those feed signals are transmitted to the brain and somehow gets back to the breast and the milk comes down. So it's described as wet nursing. So the person that asked the question can go back and read what wet nurses are, and it doesn't even have to be biologically related. It can just be another woman that that wants to breastfeed another baby that is not biologically hers. So it's possible. Yes. And in our environment, like we're even advocating for things called milk banks. So for some women that are really finding it difficult to lactate, to produce enough milk. Some people produce milk. Some people, I'm like a cow. That the milk is so much safe, so they will need to store it. So we can actually have milk banks, and especially for working mothers, people that go back to work, they say, it's not enough, Jare. I can't. Even the stress enough. Because most times it's not like these mothers don't want to breastfeed after they go back to work, but the stress, and for you to breastfeed, you have your stress levels has to be very low. You have to be relaxed. Your state of mind has to be calm. And in this Lagos, it's not easy. You can't be calm in this Lagos. Once you've been in traffic for how many hours, maybe you're even angry from work, then you now get home and to breastfeed again. So we can have milk banks that you could just get milk from the bank to breastfeed your baby so that your baby still has the benefits of breast milk. But our environment, there's so much cultural. People won't see it as it's my own. Titemi, it's my own. So it doesn't. We want the best for the child. It's just for the child to have the maximal benefits from breast milk. So, and at the same time, we could even use this in hospitals for the sick babies or for very small babies that we want to treat with breast milk. So I hope I've been able to answer that question.
Yes, you have. Thank you, Dr. Zainab. And I think this is for you, a follow-up question on the person who was feeding on one breast. She said, I have tried to alternate the breast, but she's always biting me. I'm not just comfortable with the second breast, and there is no milk in it anymore. So she's been able to
Wow.
explain why.
Wow. Wow. So I think so this will be for subsequent mothers. So while you're initiating breast milk from the beginning, just alternate. I'm sure, I don't know, I don't want to assume, but one of the reasons, or maybe an additional reason to this mother's complaint must be there must have been a position that was just comfortable. The one she likes was a comfortable position, and both for the mother and the baby. So alternating to the second uncomfortable position, when the baby does like that, from the you go back to the comfortable one. So somehow the baby is just comfortable on that position. And babies, they are very, they have a way of just adapting to one particular way. So, but if right from the beginning, even if it's not comfortable for both the mother and the baby, but you still try to use the second hand and the second breast, over time, the baby gets used to the two breasts. So let's just try it from the beginning. Don't make one favor one breast over the other, if I'll put it that way.
Okay, thank you very much. I think we should wrap up now. Unfortunately, we
Yes.
can't take all of your questions, but I hope you have learned a lot. I hope you have learned something. Thank you very much for our beautiful professionals who have given their time. We appreciate you. Thank you. God bless you. So I'd like to take final words. I'll start with Dr. Oluwatu Singh. Final words in breastfeeding for everyone out there.
Okay, thank you so much. Final words. If my final words can be anything, I would say breastfeeding is so beneficial. It's one of the best decisions that a mother can make, and that decision is not just going to impact her, it's not just going to impact her baby, but it's for the future. It has such tremendous impact, and the world recognizes it. That's why so much work is going into finding out what can help breastfeeding, what we can do to make the indices better, get more mothers breastfeeding. And the second part is this: I've emphasized that get out of poverty. It is a ticket. I continue to say it. And the third thing that I would say is, if you've succeeded, help someone else, because there's mother and say nobody told me about this. Nobody told me that it was going to be like this. So if you've gone through it, educate another woman. She may not be pregnant. She may be trying to be pregnant. She may be wanting to have a baby. Let her know this is about breast. This is breastfeeding. This is what it does. This is benefit. This is the process. You have to prepare your mind. You have to be, mentally ready for it. And just even for those that are in the process, really encourage them. Like I said, the support is crucial. I think I would end on that note. Thank you all for listening, and I hope that this session has been an impactful.
Thank you very much. So, Dr. Zaina, final words.
Okay, so I'll start by saying, I know every mother wants the best for his or her baby. Like we want to give them the head start in life, like Tosin said. Well, we can start by preparing for the breastfeeding. When I'm preparing with our mindset, so we should tell ourselves it's doable, irrespective of many challenges that might come along the way. So we should, before you even have the baby, preparing, and you need support. You need going along the theme for this year. You need support from your husband, support from the healthcare workers, support from your family when the baby is actually born, and support from work. We also need that support, and I'm sure many corporate bodies are already doing things to promote breastfeeding in organizations. There are crèches at work, there are breastfeeding rooms, so we need that support to establish this exclusive breastfeeding and optimal breastfeeding on the long run. So it's doable, the benefits are enormous, and I'm sure if daddies are watching here, or managers of businesses and all that, let's bear in mind, let's put it at the back of my mind and think of ways we can help these breastfeeding mothers achieve this goal of giving their babies optimal breastfeeding. Thank you very much. I hope this session has been beneficial, and you could also, I don't know if the organizers have a way of getting us the questions. We could just reply them when we are free or something. Okay. So we have answers to the questions later. Yeah. Thank you.
Okay. All right. Thank you very much. Thank you for your time, Dr. Zainab. Thank you, Dr. Luatosin. We really, 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 really appreciate you. And I want you to go home with one or two things. It's very, very economical. You save money. It's very, very
Yes,
healthy for you and for your baby.
yes,
And then
yes,
prepare.
yes.
It's a mindset thing. Just prepare and get ready for it. Okay. Thank you. All right. Our breastfeeding week continues. It doesn't end today. So follow us on our social media handles on Instagram, on Facebook, on YouTube, and look out for the other past programs that we have for 2020 breastfeeding week. All right. Make sure you don't miss out on any of it. I am sure you have time today. I'm sorry we could not take all of your questions. Apologies, but we'll find a way to get all of them answered and get back to you on that. All right. So on this note, I want to say thank you for joining us today. God bless you. We appreciate you. Keep staying safe. It's very, very important. You have to keep staying safe and continue following us for the rest and other programs on the Breastfeeding Week on ATP, on Instagram, on Facebook, on YouTube. All right. Thank you and bye bye. For all the announcements, you can check it on our social media handles. Bye, everyone. Thank you for your time. Bye bye.